in 1975, and I joined ASHA in 1976. So that does date me a little bit, but I took some time out from my professional life to enjoy my two children. I started out in public health and then went to public school and then ended up in a private agency. And right now I'm at Blue Ridge Community College as an instructor. So
Okay.
very part-time.
Okay, great.
And ASHA is the American Speech and Hearing Association, correct?
Yes, and it's a wonderful they have a wonderful website. You go to ASHA, ASHA.org, and you can get a lot of information there too.
Great.
Great, thanks. So, when did you and how did you first become interested in the speech pathology field?
I think it goes back to my great aunt was deaf, and we little kids didn't realize it at that time. And then I saw my mom, my younger brother had a lisp. So every time his tongue would go through his teeth, she would just kind of push his tongue back in there. This was when he was 5. And that kind of intrigued me. And then I heard about audiology when I was in undergraduate school. I graduated from WVU in undergraduate school, and then that piqued my interest into speech pathology. I heard about that, and I was thinking, oh, that is perfect. It's perfect for me. And so I got my graduate degree at UNC in Greensboro.
Okay, great. And then after graduating from UNC, what was your next position after that?
I went into public health for about 2.5 years. So that was just so interesting. It was under the program of children and youth, and we started seeing babies at age 8, and we would see our clients up to age 18, and they were medically indigent families, so we could follow them. And they would come through, they would see the other services, social services, and of course their nurses. Then they would come through our clinic, and we would make sure that their hearing was fine and that their speech was fine.
Okay, that does sound very interesting. All right.
It was so intriguing. It was such good training after graduate school because it was almost that you would see one of everything, being in public health.
Mm-hmm.
And then we provided some therapy, but most of it was diagnostic at that time.
Okay.
Did you work with hearing people who had speech impediments, or people who were deaf, or both?
It was more with speech. Yeah, because you can be trained under the hearing component as an audiologist, or then you go under hearing impaired, and you can qualify for that. With hearing impaired, it's a little bit different field.
Okay. So do you have experience working with hearing impaired children?
Some, yeah. But most of the time, our audiologists would watch and track our hearing impaired children through the public school. But if they had some speech problems, then I would see them also. But most of my caseload would have to do with articulation or language impairment, delays, disorder, fluency problems, that's stuttering, or voice. But most of it would be under articulation, if you had to break it down that way. So it would be more the speech sounds that were delayed or disordered.
Okay, I see. So what would you say is the most challenging part of your job as a speech pathologist?
I would say that the paperwork, it became totally inordinate, the requirements for that, and they expect the speech pathologist to handle all of that, and it is paperwork heavy, where you have to document everything. And so the IEPs were kind of heavy duty, and yeah, I don't know, it just seems that that's part of it, so that you just have to be prepared for that the paperwork part, crossing your T's and dotting your I's and making sure that when you put that document together that it's all together. Because you're signing it, and you're signing all your credentials and everything. So
Yep, and your signature means a lot.
That is important for sure.
Okay. Yeah, I can see how that would be challenging, a challenging aspect of your field. And then what would you say is the most rewarding part of your job?
The most rewarding part is, of course, the children, working with a variety of clients. And I would say that interaction that you have with your clients, with the children, and then later, let's say in the rehab and with the adults. But the interaction, I would say, that is so rewarding. And when you have little kids that see you and you might be walking through the cafeteria and they just want to give you a hug, well, you just accept all those hugs, even if they've got spaghetti, and later on you notice you've got spaghetti on the back of your blouse. So all of that is just really heartwarming, and I have worked with the most wonderful people my whole life, that they are caring and dedicated to what they are trying to get these kids better, or the adults better, have a better way of communicating.
Absolutely.
What advice or words of encouragement would you have for parents who have children who have issues with speech?
I would say that if they have any questions, that they can go to the public school and get free speech screenings. And if there are doubts, that really listen to that little voice, because often that little voice is correct if they are just not sure. And now doctors are required to do a lot of screenings on these infants and babies in order to determine whether or not a child is on the spectrum of autism. So that's a big push right now, and it's very important. The sooner you start in rehab with those babies, those children, the better their outcome is.
Okay. So what are some signs that parents should look for that might indicate that their child does have hearing loss?
Hearing loss, if they're babies, and if they're pulling at their ear a lot, if they are congested, the eustachian tube does not really fully mature until they're about age 3, and that eustachian tube then up to age 3 is more or less sort of like this, horizontal, and by age 3 then it's going down. So the middle ear can get full of fluid very quickly. In fact, the ear, nose, and throat doctor told me within 15 minutes you can build up fluid into that middle ear system, and then you're on your way to an ear infection. And if they're older and they're sitting, let's say, in front of the TV, and they have it really loud, that volume is loud, then that's an indicator that something's going on. Or if they're saying "what" frequently to conversational level, yeah, that's an indicator also. And the best advice I could give for to avoid hearing loss later in life is stop listening to music through your headphones super loud. Like if you walk by and I can hear that music, that's too loud. Because how do you repair that? There's no way to repair that delicate system in there. Don't do it.
That's a good rule of thumb. If someone can hear you outside of your headphones and it's too loud, you turn that down.
Too loud. And if you're out on a lawnmower, anything loud, yard work, you should have the earplugs in, and maybe something even over those earplugs, because all of that is going to possibly affect your hearing later in life.
Yeah, hearing something that's very valuable, and once it's gone, it's hard to replace.
It is very hard. I mean, it's near impossible right now. It's near. It won't be the same.
Yeah. All right. So
what you're born with.
The last question I have is, could you just tell us about one of your favorite moments in your career as a speech pathologist? Something that's not violating any code for you to tell us.
Oh, I don't think I have any one experience. I just know that parents are very appreciative with you working with their children, and a lot of parents have stayed in touch with me, even though, let's say, their children have graduated out of the program. I have one mom in particular that I still stay in touch with, and it meant so much to her because her daughter came in who was very difficult to understand, and she was 4. And we worked together, I think, up until maybe she was in 1st grade. So to improve, those sounds, your communication skills, and I just believe communication is basic. It's so fundamental that it's easy for other kids to pick on other children if they are just a little bit different. If they have a lisp, or if they have difficulty with their R's, or if there's a whole string of sounds that they can't make. Another little boy that I also saw as a preschooler, who the only sound that he could make was a W, a W sound. That was the only sound, and by that time he should have had many sounds. And you can't go around in life using that W sound for everything. So, yeah, but I couldn't, key in on one wonderful moment. I think there's been a combination of moments that really warm your heart. And I have to say also that I've never been bored. This is not a boring field of life, experience. It is. You learn something with every client. It's so dynamic.
Absolutely. That's great. That's all I have. Do you have any other questions, Patrick?
Nope.
Do you have anything else that you would like to add?
I don't think so. Did either one of you have experiences with speech pathologists in the past? Did you, Patrick?
It wasn't related to hearing loss, but when I was in 1st grade, I started going to the speech therapist at my school because I was having trouble with stuttering and also some trouble with my SHs and CHs. So.
Well, I don't hear that at all anymore. So you had quite.
It was successful therapy, I guess.
Mm-hmm.
And sometimes, when you do deal with stuttering, you never know how the outcome is going to be. But the thing that I would tell my students is never give up. Never give up. And I would ask them, what is the most important advice that you can give to other students? And that was one of the things that they would also say. Try, and try again. Never give up. So, Patrick, did you have any experiences yourself?
I haven't had any experiences with speech pathologists, but I've had professors who were audiologists for some classes I've taken about hearing loss and sign language, American Sign Language, and now I've been learning more and expanding my knowledge through being connected with the DePaul School and learning about listening and spoken language. So I've learned some about the industry, but I haven't had any experiences with speech pathology per se.
All right. Now, and the DePaul School is where? Where is it located?
Pittsburgh.
Pittsburgh. Okay. Well, I was born in Pittsburgh, and Pittsburgh is north of my hometown, Morgantown, West Virginia. So, now will you go back and do any studies there, Patrick, yourself in Pittsburgh?
Maybe in the future. I'll see.
Yeah. Okay.
Thank you very much for joining us.
Oh, thank you. I hope this was all okay. And
it was perfect.
It was wonderful.
Oh, good.
Great information. Thank you so much for being flexible with your schedule as well.
Well, and I'm glad Patrick was here to help figure all this out.
Thanks, Patrick.
Yeah, thank you.
Yeah, because before I could see the two of you working together, but I could just see audio was on, and you couldn't see me, so I'm glad this worked out.
Yes, me
thank
too.
Thank you very much.
All right, so what I'll do